Welcome to cardiac monitoring with the VitalPatch. Your care provider has selected the VitalPatch to help detect cardiac arrhythmias. This video will show you how to use the VitalPatch and VistaPhone for prescribed, at-home cardiac monitoring. For more information and additional resources, please visit VitalConnect.com. The VitalPatch is a small device that you wear on your upper left chest like an adhesive bandage. You can perform normal daily activities while wearing the VitalPatch, including showering, light exercise, and sleeping. Each VitalPatch lasts up to 7 days. Your care provider will include the correct number of patches in the kit for your prescribed monitoring period. This video will walk you through how to properly apply, connect, and remove the VitalPatch, and how to use the VistaPhone device. The VitalPatch monitoring kit includes all the necessary components for cardiac monitoring. The kit may be mailed to you at home, or your care provider may give you the kit during an office visit. Remove the contents of the kit. On the right side of the kit, find the VistaPhone, charger, and charge cable. On the left side of the kit, find the VitalPatch, optional adhesive overlays, alcohol prep pads, and adhesive removal pads. The printed Quick Start guide can be found underneath the tray. Your monitoring kit may also include a pink recycling bag for used patches. Charge the VistaPhone by plugging in the provided USB-C charging cable. Plug the other end of the cable into the charger. Always keep the VistaPhone near you during the monitoring period. Keep the VistaPhone plugged into its charger near your bedside while you sleep. To check if the VistaPhone is on, tap the power key on the side. If the phone is not on, press the power key until the device vibrates and the screen lights up. To unlock, swipe your finger across the screen, and then enter the PIN code 1234 OK. When no VitalPatch is connected, the VistaPhone displays an on-screen help system that can guide you through applying the VitalPatch. Tap the Next button to view each step. We will now apply the VitalPatch. Note that you can apply the VitalPatch to yourself with a mirror, or you can have someone help you, as shown in this video. Remove your upper garment and find where the VitalPatch will be applied. The VitalPatch is applied on the upper left side of your chest. If there is hair on the chest in this area, shave the chest. To shave, apply warm water and shaving cream. Shave the area in the direction of hair growth. Rinse the shaved area with warm water and then dry. Whether you have shaved or not, clean the area using an alcohol wipe from the kit. Allow the alcohol to dry. Open the VitalPatch by tearing the pouch at the notch. Remove the VitalPatch from the pouch. Do not remove the adhesive backings on the VitalPatch until told to do so. Place the VitalPatch on a flat surface. Expose the VitalPatch to air for at least 2 minutes. After at least 2 minutes have elapsed, press the power button. A green light shows the VitalPatch is on. The light will go off. Locate the notch at the base of the collarbone and hold 2 fingers below to determine proper spacing. Hold the VitalPatch against the upper left chest with the logo side lined up with the center of the chest. Angle the VitalPatch down across the heart at an angle, with the 3 lines pointing down. While holding one side of the VitalPatch down on your chest, lift the opposite side and peel off the adhesive backing. Press the VitalPatch against the skin. Peel off the backing on the other side of the VitalPatch. Press down and around the sides to make sure all edges of the VitalPatch are secured to the skin. Do not shower or exercise for the first 30 minutes while wearing the VitalPatch. After 30 minutes, you may shower with the VitalPatch on your chest, but you should avoid scrubbing the area or spraying the VitalPatch directly. Gently pat the VitalPatch dry after showering. Do not fully submerge the VitalPatch in a bath, and do not swim with the VitalPatch. If you experience any irritation on the skin around the patch, or if the patch begins to lift off, call the customer support number printed on the monitoring kit. Your kit includes at least 1 adhesive overlay. The overlay is optional, and you should only use it when you expect the patch to not adhere properly for the entire 7-day duration. If the skin around the VitalPatch is not clean, use an alcohol wipe to clean the skin around the patch. Carefully cut open the overlay pouch with scissors and remove the overlay. Locate the angled corner of the overlay. To make the liner easier to remove, peel up a small section of the white liner to create a tab. Place the adhesive overlay over the VitalPatch with the angled corner on top. Hold down one side, and then gently pull the blue tab from under the overlay, pressing down on the adhesive as it meets the skin. Remove the second blue tab in the same way, gently press down to adhere to the skin. Starting at the tab on the angled corner, pull off the white liner. Gently press the clear overlay to the skin as you continue to remove all the top pieces of the liner. Press down firmly to seal all edges of the overlay. We will now pair the VitalPatch with the VistaPhone. Unlock the VistaPhone. Tap the Next button to begin the guided help system. After accepting the end-user license agreement and viewing the guided help screens, the VistaPhone will scan for patches. The Bluetooth ID of the new VitalPatch should appear on the list. If the ID on the screen matches your VitalPatch, tap the ID to pair to this VitalPatch. The next screens will guide you through calibrating the VitalPatch. Tap the Calibrate button to begin. Confirm that the patch is in the correct primary location and tap the Confirm button. Select your body position and then tap Calibrate and then confirm your selections. After pairing and calibration are complete, the VistaPhone will display a dashboard. The dashboard shows how many hours are remaining on the current VitalPatch. It also shows information about the VistaPhone device. The VistaPhone includes a cellular data connection, allowing you to use it anywhere there is cell phone coverage in the United States. However, for best results and to ensure continuous monitoring, VitalConnect recommends that you connect to a Wi-Fi network when you are at home. If you have Wi-Fi at home, tap the Configure Wi-Fi button. Select your network from the list. Enter the Wi-Fi password and then tap Connect. Tap the back arrow at the top of the screen to return to the dashboard. Always keep the VistaPhone near you during the monitoring period. Keep the VistaPhone plugged into its charger near your bedside while you sleep. The VistaPhone has a battery charge indicator on the screen. Check the indicator every day and do not let the battery run low. If you feel a symptom during the monitoring period, unlock the VistaPhone and tap the Report Symptom button. Select your symptoms from the list. Tap Other if the symptom is not listed. Tap Next, and then select your activity level during the symptom. Tap the Submit button when complete. Check the VistaPhone at least 2 times per day. Check how many hours are remaining on the VitalPatch. Also check that Vital Signs Uploading and Body Contact Good are displayed. If these are not displayed, follow the instructions on the screen to resolve the issue. Each VitalPatch lasts up to 7 days. When the VitalPatch expires or has less than 4 hours remaining, you should replace it with a new VitalPatch. If your VitalPatch has expired, follow the instructions on the screen. If there are less than 4 hours remaining, tap the Menu button and then tap Disconnect Patch. Confirm that you want to disconnect. Here is how to remove the VitalPatch after disconnecting. If you applied an adhesive overlay over the VitalPatch, grab a corner of the overlay and stretch it sideways across the skin to help remove it. Elderly patients should use an adhesive removal pad to help remove the overlay. The VitalPatch will begin to pull off with the overlay. If there is no overlay, use one of the adhesive removal pads provided with the kit. Pull up a corner of the VitalPatch while wiping the pad underneath. This will help release it from the skin. After you remove the VitalPatch, fold the patch in half so that the left and right sides are stuck together. Use scissors to cut the folded end of the patch. Place the folded and cut patch into the pink recycling bag. Seal the bag closed. If you have unused VitalPatch devices in your kit, your monitoring period is not complete. Before applying a new VitalPatch, follow the skin preparation instructions at the beginning of this video. If your monitoring period is complete, and you have used all the VitalPatch devices provided in your kit, you must return the equipment. Here is how to return the equipment. Power off the VistaPhone by holding down the power button on the side of the phone and then tapping the power off button. Place the charging cable and the charger in the tray. These can go in the small slots on the right or in the large compartment on the left. Place the VistaPhone face down in the slot on the right side. Place the recycling bag with used patches in the slot on the left side. If you have unused VitalPatch devices, place them in the slot on the left side. Peel off the protective layer from the adhesive strip on the top flap. Fold the top flap down and tuck in the side flaps. Press the flap down to seal the box closed. Do not return the kit to your doctor's office unless you are specifically told to do so. Flip the box over and locate the return label. Return the box to the shipping provider shown on the label. For example, if the return label says Priority Mail, drop the box off at any post office or secure return mailbox. Note that if you do not return the VistaPhone, you will be charged a replacement fee. If you have additional questions, please contact your care provider or call the support number printed on the monitoring kit.